At a French ICU nearing capacity, staff work on a man in serious condition. He is 36, says this nurse. It's rare to see someone so young. There are only 3 empty beds left. Our concern is we will have more patients than ICU beds, says the head of the department, who worries that will happen in the coming weeks. France is recording more than 50,000 new cases a day. But the government scientific advisor says the real number could be twice that. The country already has a national curfew, and the government is looking at more restrictions. This expert says France has already lost control. If we think it will get worse for several weeks, then that is unacceptable, says Dr. Eric Combe. Belgium is struggling with one of the highest per capita death rates in Europe. It has expanded curfews and shut down museums and theaters.
Closing the cultural stuff is a little bit nonsense because I think they should concentrate their energy more in another stuff.
Today, the WHO was optimistic that Europe won't need national lockdowns, but says the situation is serious.
We are seeing very, very high positivity rates and an increasing lack of capacity to do any effective form of contact tracing.
With the second wave, curfews are being used to try and control the spread. In Spain now, everyone must be home by 11 at night.
I don't believe that any government or any expert knows still what we are doing.
It's that sentiment that's led to protests in Italy. Some getting violent in Naples recently over new rules closing restaurants at 6 p.m. As each country is now attempting to get control of a virus that is yet again drastically altering life in Europe. Renee Filipponi, CBC News, London.